some people do acknowledge that the word stroke is farcical. It's like stroking the cat, which is nice. And this, like a heart attack, is a brain attack. Whether you have a hemorrhage or a clot, it's a brain attack, and without your brain, your whole body is useless.
I was talking to somebody, and suddenly I started to feel unsteady, giddy and confused, and then I started to feel faint.
I was 18, just starting a new life at university, going out, having fun, and I just collapsed. And by that time I realised that the whole of my left side had gone, my trunk, my hip, my pelvis, everything.
My stroke was caused by a blood clot moving up into my brain and cutting off the blood supply to part of my brain. Had I received treatment as soon as that happened, I might have received drugs that could have reduced the clot and enabled the blood supply to restart. It's the cutting off of the blood supply which causes part of your brain to die, and if you can receive treatment, the sooner you receive treatment, the more likely you are to recover and avoid permanent damage.
When a stroke strikes, there's a very limited time window of opportunity in order to treat the symptoms and potentially reverse the damage. So it's very important that we get those patients into hospital quickly. The FAST test stands for face, arm, speech and time, and it really is as simple as that. First of all, we test for face. We're looking at facial movements, which sometimes presents as a one-sided facial weakness or a droop. Sometimes it's less obvious and we need to ask the patient to make a smile, and then you might see a weakness on one side of the face. Next, we test for the arm movements. We ask the person to put their arms out in front of them like this. We hold their arms and then we let go. We're looking for a drift like this, or sometimes where the arm drops altogether. Then we're looking at speech. We're looking for patients that had difficulty speaking. This might present as slurred speech, difficulty pronouncing words, difficulty finding words, or not finding words altogether. Finally, there's time. Time is critical in stroke. If you see any one of those symptoms, we need to act fast. It's time to call 999.
You look very well. Something wrong with your face? Look, I'm going to ask you to do 3 things for me, okay? Now, face your face. Can you smile for me? Yeah, okay. And I'm going to take your arms, yeah, lift them up. Now, when I let them go, I want you to keep them steady, don't drop them, okay? Yeah. Okay, here we go. All right, put this one down now. Now, can you speak to me? Yeah, can you tell me your name? Okay. And do you know where you live? You do. All right. That's enough, mate. Look, I'm gonna dial 999 and call the ambulance, okay? Hi, yeah, ambulance please. Yeah, I've got a fella here, I think he's had a stroke. Yeah, I've done the test, you know, the fast test, and he does seem to have the symptoms, yeah.
When I had my stroke, my symptoms were the whole of my right side of my body was not functioning correctly. And apparently I'm told that my speech became very slurred.
As I was driving along the road, a lady ran out in front of me, so I did an emergency stop. I felt a bit dizzy, which never usually does happen. So I tried to settle and went off to drive, and then looked down and saw that my arm had fallen down by my side and my leg had fallen off the pedal, and I hadn't even noticed that there was no feeling there at all.
When I look back, it's obvious, when I had my stroke, that my face had dropped on one side and my left arm had gone limp. I was given a cup of tea and I dropped that, I couldn't hold it. And yes, my speech had become slurred. And it's obvious when you know that those three things are signs of a stroke.
I'm going to ask you to do three things for me, okay? Now, first your face. Can you smile? Now, I'm going to take your arms, yeah? When I let them go, I want you to hold them up for me, okay? Here we go. All right. Now, can you speak to me? Yeah. Can you tell me your name? Okay. And do you know where you live? You do. All right. That's enough, mate. Look, I'm gonna dial 999 and call in an ambulance. Okay? They'll be here any minute, and then I'll stay with you.
The fast test is simple and could have an incredible impact on the person concerned. It may prevent them becoming permanently disabled, it may even keep them alive.
I still have drop foot because there doesn't seem to be a lot of nerve action at all, so I can't move my foot up and I can't move my foot out, so I have a bit of a limp and I walk with a walking stick. I have epilepsy, which was developed 2 years after my stroke, which apparently is very common.
Physically, I have mild paralysis down my left side. I used to burn my hand cooking, so now I only use the right. And I'm a little unsteady, so I have to be careful with my balance. My left side is not as strong, not as sure as my right side.
You often don't get your speech back, but I was fortunate. Maybe within a month I was beginning to improve in my speech, but I'm afraid my arm and leg functions were absolutely useless. People with a little bit of knowledge of what a stroke or a brain attack is could make a tremendous difference to any member of their family, their working colleagues, or people in the street.
Face, arm, speech, time. The symptoms are easy to identify, and if you see them, think stroke, act fast, and dial 999.